Hello viewers, welcome to this video on headaches. Headaches are a common condition that most people will experience at some point in their lives. In this video today, we will discuss the different types of headaches, their causes, the categories, symptoms and treatments maybe. Now, first let's go to the categories of headache. Categories of headaches can be in two, and the issue is because the headaches itself can vary significantly in different types of ways. That includes the intensity, the location, that is the side of the head where the headache is much, the frequency, the cause, and all that. In the category, we'll take primary headaches first. A primary headache is when the headache itself is the main problem. It is not a symptom of any underlying disease. The pain from primary headache could be heavy, but they are not dangerous. Our brain cannot feel it most times. And most primary headaches comes from the inflammation of pain-sensitive parts of the body around the neck, the head, and all that. Parts like the nerves, blood vessels, or muscles around the head and the neck. These are mostly what causes primary headaches. And there are different types of primary headaches. We'll talk first about the tension headaches. Tension headache is the most common type of headache, especially in this country, Nigeria, because it is the one that comes out of stress mostly. It feels as if there is a rubber band, there is a band that is tightening your head, all around the head. The headache is often majorly caused by stress or tension around the head. Maybe you are putting on a bonnet or a sleeping net that is so tight and is so hard on your head. Then you can have the tension headaches around the neck, the head, and the shoulders. Then the migraine headache. This is a type of headache that is usually accompanied by nausea. You feel as if as the headache is happening, as you're having the headache, you feel like you want to vomit. And sometimes it could give you some kind of photophobic effect. You might immediately you see light, you'll not be able to look into the light. You'll be sensitive to light and sound. If anybody hits some reverberating thing like a bell or something, it will be as if they are ringing it in your head. It will be as if that sound is happening in your head. That one is migraine. Sometimes it affects the eyes. Sometimes. Then there's another type of primary headache called cluster headache. This is not so common. It's most times some women, when they are in their menstrual cycle, they actually feel it, because it is a kind of headache that will be as if it is happening around one eye. You feel it more on one eye, as if something is troubling that eye. And sometimes the eye could be red. Sometimes it will be as if you are shedding tears. Tears will be coming out from that eye. And you might have some nasal congestion, as if you want to have cold or catarrh. Then another one is sinus headache. Sinus headache is the one that is caused by the inflammation of your sinuses, that is around the nose bridge. Then it will affect the forehead, the nose. It will be as if you have cold. Even when you have cold, this is the type of headache you experience. So that is some of the types of primary headaches. Then we'll go to secondary headache. A secondary headache is caused by another condition entirely. A different condition that triggers pain-sensitive areas around the neck and the head. Secondary headaches could be rare. That's because there must be a serious underlying condition that is triggering them, that is causing them to happen, such as brain tumors, aneurysm, meningitis, head injury, and all that. Secondary headaches start out of nowhere. It will just start, and the pain will be extremely excruciating, terrible pain. So immediately somebody or anybody around you is experiencing a very violent headache that comes out of nowhere, out of the blues, just all of a sudden, please let that person seek immediate medical assistance, because in the long run it will be discovered that it is not just an ordinary headache. It is not just the usual primary headache. It might be something else that is triggering it. It could even be an heart problem issue. So let's now move to causes of headaches. Headaches may have different types of causes. It could be tension, it could be stress. Like I said that time, if you are wearing a particular hair net, women are fond of that sometimes. A particular hair net, that the rubber band that they use around that thing, the elastic around the net is so tight, it could give you headache. That is one of the tension headache. Or you have undergone through too much stress. You could also have, that could also be a cause of headache. And also, if you are dehydrated, maybe you are supposed to drink water and you have not taken water for hours, you could have headache. Yes, that one sometimes will also trigger headaches, especially when you are fasting. You might be feeling slight headaches. It's just associated with the fact that your body is sapped of fluid and you are a bit dehydrated. Also, eye strain. People that naturally or one way or the other are photophobic, that is, people who hardly see under sunlight or when light is bright, immediately there is strain in the eye, like you are just trying to strain your eye to see in the light. This could give you a headache. Also, when you are reading and you are straining your eyes, or when you are working on your phone or your laptop and you are straining your eyes, it could also trigger headaches in the long run. Then hormonal changes, especially in women, causes headaches too. Then allergy or sinus infections. Any allergy or particularly sinus infection could give you headache. And caffeine withdrawal too. If you are fond of caffeine, you take coffee, you are somebody that take like 4, 5, 6, 7 cups of coffee on a daily basis when you are at work and all that, and now you are like, or probably a doctor gave you a warning that too much caffeine, you have to reduce your caffeine intake and all that, and you withdraw suddenly, it could give you headaches. So you are supposed to take a gradual withdrawal of the caffeine so that you won't suffer too much headaches. Then there are certain foods and additives, especially in all this junk food we take these days, that really causes headaches. Also, another major cause of headache is trauma or injury to the head. Maybe somebody fell down, hit your head or something, somebody hit you with anything, could be blunt trauma, anything that hits the head could give the head headaches. Even if you hit your head on the wall and you have very small concussion like this, before you know it, you are having headache. Then any other health conditions, like the underlying health conditions that we discussed earlier, those are causes of headaches. Now let's go to symptoms of headaches. The symptoms of headaches can vary depending on the type of headache. The symptom you feel when you have tension headaches is usually a dull aching pain, as if an elastic is tightened around your head. That is symptoms of a tension headache. But when you start feeling nauseous, you feel like you want to vomit, you feel as if you cannot open your eyes to see the light, you just want to be at the dark places, you feel that every sound reverberates in your head and all that, that is symptoms of migraine headache. So each headaches have their own peculiar symptoms. Now, treatment of headaches, it depends on the type. and mostly the cause of the headache. Sometimes you can use over the counter pain relievers, which is common, which most maybe paracetamol and all that. But when it's if immediately you take paracetamol and or as any acetaminophen and it didn't go, then you need to see a doctor. Yes, because we can only do first aid briefly, just to watch it for a day or two. So I wouldn't encourage any self-medication, please. Then another way of treating headaches is to avoid triggers. Most of us, we know that each time I do this thing, or each time I take this food, if I take this particular food, if I do this particular chores, if I bend down this particular way, I normally have headache. Then know that all those things that you do that gives you headache, you need to avoid them. Yes, that is avoiding the triggers. And if you are the one that has that have allergy that gives you headache, please move away from all those things that give you allergies that will trigger that headache. Then another way of treating it is drinking plenty fluid to prevent dehydration. We need to take water, fresh fruit juice always, so that our body will be properly and thoroughly hydrated. When the system is well hydrated, you might not even experience any form of headache at all, especially those that their own trigger happens to be dehydration. Then another way of avoiding and treating headaches is to get enough sleep. Please make sure you get enough sleep. Sleep when you are supposed to sleep. Maintain a very good sleep habit. Once you are well rested, even if you have headache and you decide to just take a shower and lie down, by the time you wake up, you might discover that the headache is gone. That means your body probably needs rest and you have just given it to it. Then another way of treating headache is by applying warm or cold press to the head. You can put ice, in case of migraine headaches now, ice pack is always better to put on the head so that it will relax the nerves, calm the nerves, and relieves you of the headache. Now, let's go to prevention of headaches. There are also different ways of preventing headaches. Let's start by practicing good posture. When you are, this goes especially to people who uses computer, laptops and all that. Don't hunch over your laptops. Maintain a very good sitting posture. Once you hunch over your laptop, you are already bending your head in the angle that is wrong, and it could give you a headache. But immediately you are properly seated, your posture is okay, your head is straight, you are looking at your laptop straight, and your back too is straight, and at the same time you probably have a glasses on, or you have you are using a very bigger font, something that will not make you to strain your eyes too much and will not make you to hunch over your devices. So that too prevents headache, especially when you use your phone. These days when people use phone, they just sit down and hunch their back and bend down to the position of that phone. Eventually later in the day you have headache, but you may not be able to trace it back to the fact that you were hunching over your phone. Please, another way of preventing headache is not to hunch over your phone. Just sit back, relax well, and raise your phone up to meet your head. That is a better way. Then another way of preventing headache is take breaks regularly. When you are walking, please take breaks at intervals, short intervals, so that the stress will be reduced, the tension will not be there, so that there won't be any headache afterwards. Then avoid trigger foods. Also, maintain a very healthy diet. Get enough sleep. Don't wait till you have headache before you take regular sleep. Stay hydrated. Drink water always. Don't think it is when you have headache that you now have to go and drink water and shower. So let's leave it at that, as the prevention of headaches. Then, when you need to see your doctor, when you have taken this paracetamol, acetaminophen at home, and you feel that the headache still persists, the first day, the second day, please see a doctor. But if the headache comes so suddenly and is so severe, don't even hesitate. Don't even, if you take paracetamol or any other thing, then you should just be as just some immediate first aid. Make sure you see a doctor immediately, because that one could be as a result of some underlying diseases that you may not have even discovered, that are yet to be discovered. So such intense headaches should be taken to the hospital immediately and allow a doctor examine you immediately. In conclusion, on today's video, headaches are a common condition that can have many causes and many types, even many categories. But fortunately, there are so many treatment options, prevention strategies that are available to help everybody manage and prevent headaches. If you experience frequent or very severe headaches, like I said, do not hesitate. Talk to your doctor about, so that you know the cause of the headache and the treatment to take. So thank you. In our next video, we'll be taking the categories of headaches one after the other to enlighten us more. Thank you for watching and listening. Goodbye.